Hello, I'm George Morris, the Physician Incident Commander for CentraCare in our COVID-19 response. I want to thank you. I know it is early, but at least at this point, we're having some preliminary data and information that is showing that we are flattening the curve. It is starting to look like, while we still see a rise in patients, both locally in our region and in the state of Minnesota, it is not as steep as it has been in other states and countries. This is due to a lot of our preparedness, but a great deal to your efforts. While I know it's hard to do the social distancing, it does seem to be working. It is hard to stay home when you are sick. We are just used to showing up, doing whatever it takes. At this time, what it takes is for us to maintain our separation to try to decrease the spread. The other parts that I think have been helpful and effective have been to decrease our clinic loads, decrease our elective cases, control how many and who comes into our facilities. All of these policies and changes have been very difficult, but it would appear that they have been effective in at least slowing down or flattening the curve. Now, while I know that this is early success, it does not mean we are done. It does not mean that this is over. We really have to think now of keeping the pedal down, continuing this effort. We will continue making the changes we do both in our clinics and our hospitals and at homes and for ourselves. While we can't stop the wave of COVID-19, that is the pandemic that's affecting our world, we can slow it down, decrease the height of it, spread it out a little bit so we can manage it without it being a catastrophic event in our region. So I want to say again, thank you very much for what you've done so far, and I want to thank you again for what you're doing in the future to help us flatten this curve. While we know we will not be able to stop its effect on all, we will be able to slow it down and manage it as a community. Thank you again.